हाँ फिर अब लेक्चर शुरू हो रहा है, बोले घंटे बाद भेजें। नहीं कह रही है घंटे के बाद भेज देंगे, हमें जाना है। ठीक है, तक पहुंचे। पानी है उसमें, वो लिटा के जाएगा, पानी है उसमें सारा। बोला था तुमको पानी निकाल देने को, चला गया।
उसी के वर्तमान वीडियो अभी बाकी बात की गई है।
Bismillahirrahmanirrahim. I think we shall start now. We have almost 42 participants. I have given you almost 10 minutes to join. I think this is the maximum participants we can have today. Today's topic is the continuation of your jaw relationships. We discussed two different jaw relationships in previous classes. First jaw relation was that the orientation jaw relationship. Then we discussed what is the difference between orientation jaw relation and orientation of your occlusal rim, or occlusion, better to say. Then afterward we discuss the vertical relationship. Now today the turn is for your horizontal jaw relationships. जॉ खाली आपका अप एंड डाउन मूव नहीं करता,
Your jaw is moving not only up and down, that is your vertical relationship, but is moving anterior posteriorly as well, and side by side. So this all movement is the forward movement, the backward movement, the lateral movement on your left side, and then on your right side. These all movements are belonging to this category that is called horizontal jaw relationship. ये जितनी horizontal movements हैं आपकी, ये categorized होती हैं as the horizontal jaw relationship or horizontal maxillomandibular relationship. In past, we used to use different terms for this horizontal jaw relationships. We used to use flip puff relationship. We used to call it mush relationship or biscuit bite or squash bite. You did not hear these things, but when I was a student, I used to hear these terminologies, the biscuit and the squash bite. But nowadays, these terms we are not using. Why? Because these terms do not have that much significance. These terms are not self-explanatory as far as the relationship is concerned. Horizontal jaw relationship is the better term, which gives you some clue that what we are trying to discuss basically. So we can classify your jaw relationships, horizontal jaw relationships, further into two different categories. One is your centric relationship and other is your eccentric relationship. ये term आप किताबों में जगह जगह पढ़ेंगे. Centric. It's nothing. Your jaw is moving forward, backward. As I told you, lateral movements. These all movements are starting from some point. That point is called centric relationship, the 0 point. For example, if some movement is starting, for example, the forward movement, again your jaw will go back. You move forward, you will go back. You will move left, you will go back. If you will move laterally on the other side, again your jaw goes to its 0 position. That 0 position is called centric relationship. Other than centric means that 0 point. Other than that, all the positions are eccentric positions. Like forward position, when you're moving the jaw forward, that is eccentric position. If you're moving the jaw laterally, means on the left side, it is eccentric position. So all other relationships other than your centric are your eccentric relationship. But from understanding point of view, we have categorized them into two groups. One is your protrusive relation and other is your lateral relations. Lateral relations might be on a left side, might be on a right side. This is either on a left lateral relationship or a right lateral relationship. So we will start from the 0 relationship. That is from where your all the movements are starting, the centric relationship. If your jaw, for example, you are fabricating a complete denture and you'll not be able to record a centric relationship, means your 0 position, your function of your jaws will not be there. Your denture is not going to be stabilized. Why? If you see just wherever you're closing jaw, all the time you're trying to masticate the food, you have a cusp to fossa relationship all the time. 1,000 times you close the jaw, you would have this centric occlusion there, where your cusp and fossas are meeting together. That is your centric occlusion position. It's not centric relation, but one thing is very, very important. This centric occlusion is normally we established at your centric relation point. This is the objective. For example, when we were discussing the vertical dimension, we said that we have two types of relationships. One is your vertical dimension of rest and other is your vertical dimension of occlusion. So when we lose the vertical dimension of occlusion, we focus on your vertical dimension of rest, which is always be there because that is depending on your muscles. So similarly, when you lose your centric occlusion, you focus on your centric relationship. So why? Because as I told you, this is the zero position of your jaws for your horizontal movements. If you record this movement and transfer it over your articulator and you establish your occlusion on this point, your denture is going to be stabilized. We, as a natural dentition, if we talk about this, usually exists. This is established by your nature there. So what is the centric relationship? To understand that centric relationship is very, very important. अगर आपको ये नहीं समझ में आती, so we will discuss what is the centric relationship. So this is your joint. Before understanding your centric relationship, you have to understand the anatomy of your joint. See this. This is your articular eminence. This is the shape, S-shape bone there. This is called articular eminence. And if you see this S, this is the topmost part of your S. And अगर आप सिर्फ slope की बात करें, if you just talk about the slope of your articular eminence, this is the slope. This is the slope area. From here, it is starting to this level. This is the slope of your articular eminence. Just focus on your anatomy. So the anterior most part of your slope is this area, and the topmost part is this area. So this area is the topmost and the anterior most part of your slope of your articular eminence. This is your intervening disc. इस disc में ऊपर भी space होती है, नीचे भी space. You used to have a space on the upper side of your disc and the lower side of your disc. This is called superior cavity and the inferior cavity. In both of these cavities used to have synovial fluid that reduces the friction in between your two bones. One bone is this, and other bone, this articular eminence area is the petrous part of your temporal bone there, and this is your condylite process, and this top part is called condyle. This articulating part used to call condyle. So if you see the structure there, this is your lateral pterygoid muscle, which is attached with the disc and your condyle there, condylite process. So whenever it contracts, it used to drag your head of the condyle downward and forward. So this is the disc, this is the articular eminence, this is the slope of your articular eminence, because this is very important. This we used as a reference to define your centric relationship. अगर इस position को समझने में आपको मुश्किल हो रही है, so then you are not be able to understand the centric relationship. What is the centric? So here there are two bones. One is your condyle and other is your articular eminence. And in articular eminence, just this portion is very, very important. The slope of your articular. Why? Because your jaw moves against this slope. It never moves forward, straight forward like this. It always moves downward and forward. Why? Because it follows the slope of this, articular eminence. So interiorly, this muscle is attached. Posteriorly, these are the ligaments. These ligaments are called retrodiscal ligaments. So it moves forward, but this movement, the forward movement, is blocked by retrodiscal ligaments. One thing you should keep in your mind, that your ligaments cannot start the movement. They all can only stop the movement. They can only modify the direction of your movement, but they cannot start the movement. So start of your movement in your joint is always a responsibility of your muscle there. कोई ना कोई muscle जरूर होगा जो इस movement को start करेगा, initiate करेगा. So this is the structure of your joint there. इसके चारों तरफ एक you will always find a capsule around this joint, and in that capsule you used to have capsular ligaments there. फिर कुछ extrinsic ligaments भी होते हैं. We are not concerned with these extrinsic ligaments. So what is basically the structure here of your joint? You have this two bones intervening with the disc, and this thinnest part, you see this disc is thick on both ends and thinner in your middle area, dumbbell shape जिसको आप कहते हैं. So this thinner portion is avascular, aneural, means जिसमें कोई blood vessel नहीं है, कोई nerve नहीं है. So whenever this force is applied on this area, you do not feel any pain there. So that's why if your disc slips and this corner portion comes over this area, your patient is going to feel pain. So that is the area where we discuss that this pain is because of the internal derangement of your joint, and that is categorized as TMD, temporomandibular dysfunction. There are so many causes, might be trauma or some, you know, chronic trauma, might be some acute trauma, might be some, you know, haphazard accident of your patient, जिसको आप road traffic accidents भी कह सकते हैं. Because of that, your joint might be damaged. There heterogenics भी हो सकते हैं, where you are treating some patient, you are doing some surgeries, and you have damaged the joint there. So this dynamics of your joint is depending on the anatomy. Each and every structure of your joint is responsible for some function there. So your disc is intervening between two bones, and its thinnest part basically is coming over these two bones there. Here there is no relationship of your tooth. It's a bone to bone relationship. This centric relationship is a bone to bone relationship. यहाँ कोई दांत का कोई काम नहीं है. So if you have the extraction of all of your teeth, but this relationship exists there. The centric relationship फिर भी रहेगा. That's why we used to focus on this centric relationship in order to establish the centric occlusion. As I told you, centric occlusion is established at this bone-to-bone relationship, where your head of the condyle with the intervening disc is lying at the topmost. This is the topmost, जहाँ arrowhead है आपका. The topmost and the interior most part of your slope of your articular eminence. मैंने आपको पहले बताया था, slope of articular eminence is very, very important. This is the modern definition. This is the new definition of your centric relationship. इसको भी अब 10 साल हो गए इस definition को आए हुए. In the past, we used to say that this is the distal most position of your joint, but this is not, you know, true. Why? Because we have a space distal to this relationship. We have a space here where we have retrodiscal ligament. So this is not the distal most position of your joint. This is the position of your head of the condyle with intervening disc at your superior most and this interior most part of your slope of your articular eminence there. That means your joint, this head of the condyle, not only can lie in this position, but can also move downward and forward. If it moves downward somewhere here, this is not your centric relationship. This is your eccentric relationship. This is other than your centric relationship. So your joint kept in this position till 20 millimeter of your movement of your opening. There are two movements possible in your joint. One is the rotation of your head of the condyle. Other is your translation. Translation means bodily movement of your joint. So this head of the condyle moves downward and forward, left this zero position. This zero position is your centric relationship, where your head of the condyle with your assembly is this condylar assembly lying at the superior most, anterior most part of your slope of your articular eminence. This is very, very important part to understand. So I repeated this definition multiple times, so you can see this one by one. This is maxillomandibular relationship. Yes, here maxilla is associated with the mandible. This is the maxillary part. This is the mandibular part. Condyles articulate with the thinnest avascular portion of, आप चाहें तो यहाँ a neural भी ऐड कर सकते हैं of their respective disc. ये disc का वो portion है जहाँ nerves नहीं होती हैं या blood vessels नहीं होती, जहाँ पर head of the condyle आपका assembly बनाता है with the disc there. Then this condyle and disc assembly, इस condyle और disc को together कर दें तो this is called condyle disc assembly, lying in its most anterior superior position against the slope of your articular eminence. independent of your tooth contact. यहाँ कोई tooth contact की बात नहीं हो रही. This is bone to bone relationship. Here there are two bones. One is from your maxillary part, and another is your from maxillary mandibular part. They are considered to establish this relationship. So you cannot see this relationship, but we have certain clues to obtain this relationship. Again, this is the repetition there. This is your head of the condyle. This is red part is your disc. This is your lateral pterygoid muscle. You can see the superior head of your lateral pterygoid muscle attached with your disc and your anterior part of your head of the condyle. This is your this is your articular eminence and this slope of your articular eminence. This is the topmost superiormost part of your glenoid fossa there. This is your retrodiscal. If you focus here, the cursor, retrodiscal ligament. So this is your external auditory meatus. This is sphenoid bone. This is the whole anatomy in this region there. But we are more concerned with this relationship there. So again, the diagrammatical representation of your centric relationship. See here, this is your articular eminence, and this is the slope of your articular eminence there. This is the topmost and the interior most part of your slope of your articular eminence there, your glenoid fossa. This is your disc. And when this relationship is there, your teeth are not in contact. Whenever you have this relationship, this is bone to bone relationship, no concern of your teeth there. But one thing you should keep in your mind that you always try that your cusp to fossa relationship means your centric occlusion should be established when you have this relationship. When your joint is having this relationship, that means your centric relationship, the 0 point, you try to establish the centric. Why? Because your head of the condyle do not move from this position within 10 to 15 millimeter of your movements. So see this again, when your joint left this position, the centric relationship, you can see here your head of the condyle moving downward and forward, leaving this centric relationship position by the activation of this muscle, the superior head of your lateral pterygoid muscle there. So whenever you have an opening there, your head of the condyle has to left this position of your centric relationship. Again, that this white one was the centric relationship. This red one is your eccentric relationship. Whenever you open the jaw more than 20 millimeter, 15 to 20 millimeter, your jaw has to move downward. Your head of the condyle has to move downward and forward, leaving this 0 position there. So this is your centric occlusion. If your head of the condyle is in this white position and your teeth are meeting together, this is called centric occlusion. So when your head of the condyle in its most superior anterior position in relation to your slope of your articular eminence and your teeth are meeting together, that is your centric occlusion. So this is the basic idea that what we want basically. What is the significance of this centric relationship? If you have centric occlusion in your patient's mouth, no need to record the centric relationship. You just directly try to record the centric occlusion as we used to do, as we have done in this position. This is your centric occlusion. If you have, sufficient number of teeth there, at least one tooth in your anterior segment and one tooth on both left and right segments meeting with the opposing tooth means occlusion. The upper tooth and the lower tooth are meeting together in every segment. Left segment, at least one tooth, right segment, at least one tooth, and anterior segment, at least one tooth. No need to record centric relationship. Then you directly record the centric occlusion. But in our case, where we are dealing with the complete denture patient, we do not have centric occlusion. We have to establish the centric occlusion. So what we will do, we will record the centric relationship, and on this same relationship, we will try to set your teeth, the upper and the lower posterior teeth, to have occlusion. So centric relationship is more definitive and independent of your tooth presence or absence. आपको जरूरत ही नहीं है इसमें दांतों की to record your centric relationship. That's why we used to focus on your centric relationship when we have we lose this centric occlusion. So recordable and reproducible over a period of time means ये आप रिकॉर्ड कर सकते हैं और रिप्रोड्यूस कर सकते हैं, चाहे बार बार भी ये पोजीशन आ जाएगी आपके पास, आप बार बार चाहें बार बार रिपीट हो जाएगी. It serves as a reference. It serves as a reference to establish an occlusion. यहाँ मैं एक बात और ऐड कर दूं, recordable, reproducible over a period of time, but you have to direct your patient to record this relationship. This is not ultimate. Your patient is not going to give you ultimately this centric relationship. You have to learn this art to how to record this centric relationship. When centric relation and centric occlusion means, when you centric relationship means you're talking about the joint, you're not talking about the teeth, means the joint relationship and the tooth relationship or teeth relationship do not coincide. Means when you establish the cusp to fossa relationship but your joint is not in your zero position, you might have some periodontium problems, you might have some trauma to your teeth. If you have the denture in situ, your denture is not going to be stabilized. वो patient जो है वो कहेगा मेरा denture जो है मुंह में टिकता ही नहीं है, जब भी मैं close करता हूँ ये trauma करता है, ये आगे पीछे भागता है. Helps to detect the mounting error. अगर आपके पास कोई mounting error कहते हैं, you have set the articulator, you have transfers your relationships, but you have some error there, you have to repeat this relationship. अगर आपकी centric occlusion ठीक नहीं लग रही आपको, तो आप centric relation को दोबारा से record करके उसको transfer करें over your articulator and try to see the errors there. Accurate centric relation records are very, very important. Why? Because if your centric, your zero position is not transferred over your articulator properly, your mechanics, your movements are not going to be duplicated. So if your start of your journey is not okay, you are not going to have a proper destination. This is the clue for your centric relationship. This is the start of your journey. If you start your journey in a right direction, you have to have a proper destination then. See this now, after 20-30 minutes people are joining. It's not good thing. They're disturbing me. So what are the methods to record your centric relationship? यहाँ जाके थोड़ी सी बात आपको समझ में आएगी कि इसका मेथड क्या होता है रिकॉर्ड करने का. We have tactile interocclusal check record जो आप OPD में हम आपको करवाएंगे भी, अभी आपको समझाता भी हूँ किस तरीके से होगा. कुछ फंक्शनल च्यू इन मेथड्स हैं, इनको ज्यादा आप कंसीडर नहीं करें. इसमें इंपॉर्टेंट है ग्राफिकल मेथड जो कि आपको समझ में भी आएगा, एंड इट इज द मोस्ट एक्यूरेट मेथड of recording the centric relationship. Not only the centric relationship but eccentric relationship. एक बात जहन में रख लें, जितने भी ये methods हैं ये सब centric को भी record कर सकते हैं, eccentric को भी, because this is the same route where you have to locate two different areas, two different destinations. One is your 0 point and other is the far part of that line. Means you are moving, means your jaw is moving forward, it is moving from where it is moving from 0 point, then again it goes back to your 0 point. That means if you are able to record the 0 point, you can move the forward area as well. So you can have intraoral method. This graphical method has two different ways. One is your intraoral tracing method and other is your extraoral tracing methods. We will discuss that. Then your terminal hinge axis method जो अभी हमने फेस फॉर रिकॉर्ड किया था वो था. इसको ज्यादा कंफ्यूज ना करें, वो हम बाद में इसको सिंप्लीफाई करता हूँ, फिर इसके बाद आपको समझ में आएगा क्या होता है. इसको छोड़ दें. टेक्टाइल ये दोनों काम कर सकता है, कैन रिकॉर्ड द सेंट्रिक रिलेशनशिप, जो पहला मेथड है, और इट कैन आल्सो रिकॉर्ड द इसेंट्रिक रिलेशनशिप. स्टेप्स क्या होते हैं टेक्टाइल इंटरक्लूजल चेक रिकॉर्ड मेथड जो होती है आपकी? पहले आपने ट्रेन करना होता है पेशेंट को. इंडेक्सिंग द रिम, ये मैं अभी आपको समझाता हूँ सारा किस तरीके से होगा, और देन यू रिकॉर्ड द रिलेशनशिप देयर. सो अब इन तीनों स्टेप्स को देखते हैं, आपको बात समझ में आएगी. Training of the patient, yani before recording the relationship, you have to train your patient what you are trying to do. Insert both of your rims, the maxillary rim and the mandibular rim. Why? Because you have done the orientation relationship, you have done the vertical dimension. Now rims are in your hand. Insert the maxillary rim and the mandibular rim. And then you have two different ways. One is your chin point guidance and other is your bilateral manipulation. चिन पॉइंट गाइडेंस आप देखें, आपने फिंगर जो है एक चिन पे रखी हुई है, एक हाथ से आपने मैक्सिलरी डेंचर को कंट्रोल किया हुआ है या वैक्स रिम को कंट्रोल किया हुआ है, दूसरे हाथ को आपने चिन के ऊपर थोड़ा सा लोअर पार्ट ऑफ योर डेंचर की को जो बेस होती है उस पे अंगूठा रखें और ट्राई टू मूव द जॉ बैकवर्ड, डाउनवर्ड एंड बैकवर्ड. इसमें उल्टी फोर्स लगानी होगी. वहां से फॉरवर्ड एंड डाउनवर्ड मूव करता है, यहाँ से आप डाउनवर्ड करके अपवर्ड मूव करेंगे, डाउनवर्ड एंड देन अपवर्ड. दिस मूवमेंट विल बी इन दिस डायरेक्शन, बैकवर्ड एंड डाउनवर्ड, बैकवर्ड एंड देन अपवर्ड. ठीक है. इसी तरीके से बायलैटरल मैनिपुलेशन में क्या होगा, बायलैटरल मैनिपुलेशन का मैं आपको डिटेल में बताता हूँ. स्टेप 1, रिक्लाइन द पेशेंट. ठीक है, बिल्कुल स्ट्रेट इस तरीके से, ये जो पोजीशन नजर आ रही है आपको रिक्लाइन कर लें उसको. देन स्टेबलाइज द हेड. हेड जो है आपका बैक रेस्ट पे सपोर्टेड होना चाहिए, हैंगिंग नहीं होनी चाहिए, हवा में नहीं होना चाहिए.